All around the world, people are speaking out.
It has made it more democratic.
Over 1,000 kids have been separated.
Physicians for Human Rights documented the use of chemical weapons.
Building a movement for profound social change. Now, more than at any time in history, health professionals are on the front lines of the struggle.
We were just speaking with the many medics.
For basic rights, health, equality, dignity, and justice. Physicians for Human Rights is mobilizing new advocates, wielding the power of science and medicine, fact-based disciplines that give us authority and credibility, because we know that through evidence, change is possible.
COVID-19 can be characterized as a pandemic.
As the coronavirus first began to spread rapidly across the globe, PHR pivoted immediately to make the pandemic a central focus of all areas of our work. We called for leadership to protect frontline health professionals.
Thank you so much for joining us once again for our speaker series. We welcome leading voices in human rights, science, medicine, as well as voices from the front lines.
We knew the inequalities that we saw in testing would be recapitulated when it came to vaccines.
And continue to advocate for vaccine equity around the world. As cries for racial justice proliferated across the United States and the world, police met protesters with barrages of tear gas, rubber bullets, and excessive force.
Newly released body cam footage shows the moment a protester was hit in the face with a rubber bullet.
PHR deployed a rapid response team to document local and federal forces' brutal violence. Our work helped spur police reforms, bans on the use of crowd control weapons, and investigations into police violence in cities across the United States.
Kids held behind chain-linked fences and razor wire.
Child internment camps, that's what I said.
We at Physicians for Human Rights call for a review of the policies related to border enforcement.
More than 100,000 people seek safe haven in the United States each year. Many survivors of torture, trafficking, and other forms of persecution.
I'm here with Physicians for Human Rights along the U.S.-Mexico border.
People are living here in camps, and we hear stories of lack of access to medical care, people being kidnapped, being threatened.
When U.S. authorities began separating children from their parents, PHR immediately sounded the alarm. PHR published the first medical and psychological evidence of the harms caused by the U.S. administration's catastrophic family separation policy.
In the words of Physicians for Human Rights, what they ended up doing was torturing.
PHR will continue to push for justice for families separated at the border, and to ensure fair, humane immigration policies at the U.S. border that are rights-respecting. Every year, countless numbers of women, men, and children endure brutal violence due to conflict and instability.
How can we build accountability for these crimes if we are missing adequate evidence?
Our experts provide training to our partners to help document sexual violence, torture, and mass atrocities. Around the world, PHR brings local sectors together, doctors, lawyers, judges, and law enforcement, to enable convictions for these horrific crimes.
There was a mark on the left side.
PHR supports our partners through our award-winning Medicapt, an innovative mobile application that allows clinicians to collect, securely store, and safely transfer forensic medical evidence of sexual violence.
estimated that 14% of women in Kenya experience rape at least once in their lifetime.
In Kenya, PHR's work helped secure a key victory for victims of sexual violence. It was the first time ever that the Kenyan government was held accountable for its failure to protect victims and investigate rapes and sexual assaults that occurred in the aftermath of contested elections.
They have won what is now seen as a landmark ruling and precedent-setting for thousands of victims who suffered atrocities committed against them.
In the Democratic Republic of the Congo, dozens of girls, some as young as 18 months old, were raped during a 3-year reign of terror in the village of Kavumu. In a landmark case at the end of 2017, based on crucial forensic evidence provided by local medical and legal professionals trained by PHR, a military court sentenced the perpetrators to life in prison. Wherever healthcare is under attack, PHR is there.
The Russian military launched more than 100 ballistic and cruise missiles into Ukraine last night.
Ukraine calls this strike, which hit a maternity hospital in Mariupol, a war crime.
As the horror of the Russian invasion unfolded, PHR immediately sprang into action, creating and disseminating resources to investigate and document these war crimes so that those who commit these atrocities could face justice. And after more than a year of an ongoing military coup in Myanmar, PHR and our partners continue to document overwhelming evidence of the military regime's deadly targeting of hospitals and healthcare workers. We have also documented human rights abuses targeting Myanmar's Rohingya people and other ethnic minorities.
We're here in Balukali camp. We're seeing the lucky refugees who were able to survive.
Our investigations documented the horrific, complex physical and psychological toll of sexual and gender-based violence on the Rohingya people. The evidence we've gathered is critical for ongoing accountability efforts that will one day bring the military and security forces of Myanmar to justice.
Hospitals have been repeatedly bombed in what has been described as a systematic campaign to force the opposition to surrender.
Throughout more than 10 years of conflict in Syria, PHR has meticulously documented criminal attacks on hospitals and the targeting, detention, and torture of medical workers who provide treatment to those in conflict zones.
We are calling on Syria and Russia to immediately stop attacks.
Many of the physicians and nurses we work with risk their lives by speaking out about the atrocities they see firsthand.
When I was tortured in detention, I was only asked about my role as a physician.
They are increasing the dosage of the torturing because we are doctors.
So we work hard to protect them. Since our work began in 1986, we've made landmark contributions to the movement for human rights.
Landmines continue to kill and maim the innocent.
In 1991, our investigation in Cambodia helped to generate the political will to create an international treaty to ban landmines. For that, we share the Nobel Peace Prize. For more than 35 years, Physicians for Human Rights has meticulously documented egregious human rights violations. PHR will keep innovating, and together we will bring critical and credible evidence to the pursuit of justice and dignity for all. Through evidence, change is possible.